Children's, and it is my pleasure to invite you to this very special panel press conference today. Let me start by just wishing everyone a happy new year. I don't know about you all, but I am so glad that I bought a 14-day warranty, because we're only 9 days in, and I'm ready to turn in 2026 and get my money back. Of the myriad of stories that we could talk about, we are here to discuss vaccines and the most recent changes from HHS regarding the childhood vaccination schedule. I think it is so appropriate that we are having this discussion here at Boston Children's Hospital. After all, we are the local children's hospital for Boston. And in our primary care pediatric network, we care for 450,000 kids across the Commonwealth. But even more than that, we are the center of pediatrics. We care for kids from Massachusetts, New England, the country, and all corners of the world. I think it's particularly fitting that we're having this discussion here in this room. This is where we have grand rounds. This is where the ideas of science and innovation have been presented for decades to demonstrate how we as an institution can impact the care for kids, not only here, but everywhere. Vaccines are critically important. I'm so glad we're having this discussion. I just want to give my own view on one thing. A lot of discussion has been about individual choice. And I'm a firm believer that individual choice is critically important. But the power of vaccines gets multiplied if we all adhere to the societal contract of let's take care of each other. Even now, are constant reminders of how our country can come together. Whether it's fire, flood, food shortage, people are willing to help their neighbors. I just wish that we could take that same view and recognize how vaccine and getting vaccinated is in line with that type of action as well. I'm going to get off my soapbox and introduce the reason why the person we're here, Senator Markey, whose idea it was to have this press conference and have it here at Boston Children's Hospital, Massachusetts native, Boston College ×2, who has dedicated his life to public service, and including the last 5 decades on Capitol Hill. First 37 years representing as a congressman, and then most recently the last 13 as senator for the state of Massachusetts. And whether it is climate change, clean energy, or consumer protection, Senator Markey has been the strongest advocate for the citizens of Massachusetts and those who need the advocacy most. Please join me in giving a warm welcome to Senator Markey.
Wow. Thank you, Doctor. And thank you, Doctor, for hosting us here today. Thank you for hosting us in this room. My mother would be so pleased because when my mother was disappointed in me as a boy, and she didn't think I was studying hard enough, working hard enough, she would just say, Eddie, we're going to donate your brain to Boston Children's Hospital as a completely unused human organ. And so I know my mother is very pleased, Doctor, that I am here with all of the brilliant people who every day serve our community, serve those who are most in need of help. Thank you to your incredible team here, Doctor. You are the reason why Boston Children's is the best children's hospital in the United States, the best children's hospital in the world. And I'm grateful to be joined by several incredible leaders and advocates for our state's public health. Dr. Bobby Goldstein, Massachusetts Commissioner of Public Health. Dr. Sarah Toomey, Chief Safety and Quality Officer at Boston Children's Hospital. Diana Cortez, the mother of 2 young girls. And Ellen McGinnis, a registered nurse with the Massachusetts Nurses Association. And we also have with us in the audience Dr. Lin Wei Chen, who is a former member of the National Advisory Committee on Immunization Practices, the group that makes vaccine recommendations to the Centers for Disease Control and Prevention. And Dr. Chen, along with all 16 of her colleagues on the advisory committee at the time were dismissed by Robert F. Kennedy Jr. just that last year. Dr. Chen, thank you for your service to our country. You deserve an apology for the way this administration treated you and your colleagues. We're here at Boston Children's, which represents the very best of Americans' medicine, science, and compassion, developing from day to day the strategies which save countless lives every single day, developing the latest breakthroughs in pediatric care, to training the next generation of pediatricians. The professionals here deliver hope to families in their darkest moments. And we can all use some hope right now. Our country is facing a dark moment. President Trump and HHS Secretary Robert F. Kennedy Jr.'s anti-science crusade continues to put lives of our nation's children in grave danger. Rather than promoting healthcare, Trump and RFK Jr. are creating a health crisis in our nation. Earlier this week, the Centers for Disease Control and Prevention announced sweeping and unprecedented changes to children's vaccine recommendations. The CDC is cutting 6 vaccines from the list recommended for all children. These vaccines are not experimental or brand new. They have been extensively studied by scientists and recommended for decades. And let me just set the stage a little bit. In 1900, 18% of all children in the United States died before the age of 5. In 1900, life expectancy was 48 years of age in the United States of America. And then vaccines and other public health interventions set the template for changing the relationship between children and this world in which they live. And that is what is under assault right now. And these vaccines that are under attack have been proven over and over again to be safe and to be effective. They're proven time and time again that they keep kids healthy and they save lives. Generations of parents have relied on these vaccines to protect their children from awful diseases, like hepatitis B, which can cause liver cancer, and rotavirus, which can cause stomach pain and dehydration. These changes aren't based on new research. Experts haven't changed their minds. What has changed is that HHS is now under the control of a conspiracy theorist who is pushing a radical anti-science agenda. This is not some minor bureaucratic tweak. This is a radical, unprecedented rejection of decades of science-based policy. We know vaccines work. Vaccines are the reason polio wards, those rooms with the rows and rows of kids with iron lungs, disappeared. Boston Children's has an iron lung down the hall from this auditorium as a reminder of the dark, old ways and of the progress that then followed. But RFK Jr. wants to drag us back decades, back to a time when parents lived in fear of polio and measles, back to an age of the iron lung. It's all part of his Make America Sick Again agenda. Vaccines are why we no longer see 18,000 children each year become infected with hepatitis B and die prematurely from liver cancer. Vaccines are why we eliminated measles from our country nearly 3 decades ago. Vaccines are why parents today no longer have to fear that a routine childhood illness could permanently harm or worse, kill their child. To ignore the science, to toss aside decades of research and trials in favor of conspiracy-laden ideology is before. It is immoral. Changing these vaccine recommendations without input from experts and without cause makes it harder for parents to know how best to protect their kids. It means children won't get the life-saving protection vaccines afford. And it endangers young children like those getting care right here at Boston Children's. Children who cannot be vaccinated because of cancer treatment or organ transplants or genetic conditions. It endangers Diana Cortez's children. So Trump and RFK Jr.'s actions put us all at risk, especially the most vulnerable. Trump and RFK Jr.'s actions put healthcare workers at risk and push hospitals to the brink. And Trump and RFK Jr.'s actions make disease outbreaks more likely. Massachusetts has sadly already lost 4 children to the flu this season. And across the country, thousands have died and over 120,000 have been hospitalized. Vaccines are now recognized universally as the reason why we were able to eliminate measles from this country 25 years ago. But as people like RFK Jr. and his ilk spread lie after lie after lie, fewer people have gotten vaccinated. More than 2,100 Americans got the measles last year. And the United States is likely to lose measles elimination status globally. There's no reason for this to happen in 2026. And the United States of America is the wealthiest country on earth. It is unacceptable and an outrage that RFK Jr. would put children at risk. Our nation's health cannot become some partisan experiment. Science cannot be optional. And we are fortunate here in Massachusetts that we can count on our partners throughout the Commonwealth to continue to follow the science as they work to protect and care for Baysitters. And we're fortunate to have leaders and advocates like those standing with me today to tell the truth and keep our communities healthy and safe. Because diseases do not abide by state lines. There is no protection which we can have unless we have a national standard. But we will have the strongest standards in America here in Massachusetts. Because local and state partners ultimately can only do so much to protect our communities if the federal government spreads lies and misinformation and makes vaccines harder to access. That's why the American Medical Association earlier this week severely criticized what is going on at the Department of Health and Human Services. They are criticizing the fact that these changes were made with no scientific basis, with no scientific evidence, with no justification. And the American Medical Association wants the medical treatment in our country to be based on science, good science. And that's not what's happening right now. And so when the physicians of our country are criticizing what's going on, you know that this is a very, very important moment in our nation's public health history. Because health is the first wealth. And MAGA Republicans are determined to rob the American people. They've cut Medicaid by $1 trillion in their big ugly bill. They've canceled billions in life-saving research, much of it happening here in the brain state. Although a Circuit Court of Appeals decision earlier this week is protecting that research money. And they have forced premiums to skyrocket for over 20 million Americans, not to mention soaring grocery and electricity costs. So families are, in fact, right now, facing an affordability crisis while Trump is trying to take over Greenland and RFK Jr. is peddling nonsense. So I'm going to do everything I can of all of my power as the lead Democrat on the Health Subcommittee in the United States Senate to protect our healthcare system. And protect the healthcare system in Massachusetts, which is the leading healthcare system in the world. To fight for science, to fight for truth, to fight for the rights of parents, to make sure their children stay healthy and safe, and to fight for the rights of children to grow up and live up to their God-given potential. So that's where we are right now. This fight cannot be waged in Washington alone. It depends on voices like the ones you'll hear today. Doctors who know the science, hospitals who see the stakes, healthcare workers who will treat sicker patients, and parents who live with the consequences for their children. And Boston Children's stands for what is possible when we trust science, invest in care, and put kids first. And that's why it is so important for us to be here in Massachusetts. Governor Healy is leading the way amongst all governors in the state, and she has designated an incredible leader to be in charge of that public health initiative in our country. He is a true public health leader, someone who makes healthcare decisions informed by science and compassion, and our Commonwealth is very lucky to have him as our public health leader. So please welcome Public Health Commissioner Dr. Robbie Goldstein. Welcome, Doctor.
Thank you for that, Senator Markey, and thank you to Boston Children's Hospital for hosting us today. I'm here today, yes, as the Commissioner of the Department of Public Health in Massachusetts, but I am also here as an infectious disease physician. And wearing both hats, I want to be very clear. Vaccines are one of the most powerful, life-saving interventions in the history of medicine and public health. Vaccines work. They prevent suffering, disability, and death. They enable children to grow up healthy and to attend school safely. They give families peace of mind. And because of vaccines, diseases that once terrified patients and parents, polio, measles, diphtheria, they've all become rare and in some cases completely eliminated. And that's why the recent decision to reduce the number of routinely recommended vaccines for infants and children is deeply concerning. This decision is not science driving policy. It's ideology overriding it. The process was opaque. The expert review was absent. The consequences are dangerous. Measles, as we've heard, is a powerful example. In the year 2000, measles was declared eliminated in the United States. Yet last year, we saw more than 2,000 cases nationwide, the highest number in more than 3 decades. And those outbreaks were driven by declining vaccination rates, which were fueled by misinformation and confusion. And we should remember, measles is not benign. It can cause pneumonia and brain swelling. It can cause death, especially in young children. I think being here at Boston Children's today is especially meaningful for this conversation. This is where so much of the science behind vaccines began. It was here in the late 1940s, Dr. John Enders and his colleagues, Dr. Thomas Weller and Dr. Frederick Robbins, successfully cultured the polio virus in the laboratory. And that game-changing breakthrough paved the way for the development of the polio vaccine, and it earned all of them the 1954 Nobel Prize in Physiology and Medicine. But Dr. Enders didn't stop there. He went on to isolate the measles virus and to develop the first effective measles vaccine. That legacy matters. It reminds us that vaccines are not abstract policy decisions. They're the product of meticulous science, of innovation, and the unshakable covenant to do whatever we can to protect our children. At a moment when vaccine confidence is slipping and when preventable diseases are returning, weakening science-based guidance sends exactly the wrong message. This is a moment to be unequivocal, to reaffirm our commitment to science and to pediatricians, to public health, and to every family in the Commonwealth. Here in Massachusetts, we will stand with children and with families and with communities, and we'll stand with pediatricians, nurses, and public health workers. We'll continue to recommend routine childhood vaccinations based on the best available science, guided by our trusted medical experts. And in so doing, we honor that legacy that Dr. John Enders and other pioneers unlocked when they introduced the science that made these protections possible. No child should ever have to suffer from diseases that we can prevent. We must not, and we will not, go backwards. because protecting children's health is not a political choice. It's a moral obligation for all of us. Thank you all for being here today, and I'll pass it back to the Senator.
Thank you, Doctor, so much. Thank you for your great work. And now I'm going to recognize Dr. Sarah Toomey, the Chief Safety and Quality Officer here at the Boston Children's Hospital. Welcome, Doctor.
Thank you so much, Senator Markey. Yeah, not quite as tall. Sorry about that. I am the Chief Safety and Quality Officer here at Boston Children's. I'm also a pediatrician, and I'm a mom. I want to start by just acknowledging, like all of the other speakers, that there is a long history and long-standing science demonstrating the safety of hepatitis A, rotavirus. These vaccines are safe and they are effective. As was mentioned, as you entered the auditorium, you passed by what was called the iron lung. I want to just remind all of you, as Senator Markey also alluded to, that back in the 1940s, it would often be the case in the units up here right at Boston Children's that there would be numbers of children who would be in these iron lungs for days to weeks to months trying to recover from the polio virus. The iron lung now is obsolete. It is a piece of our history. It is a vestige of long ago. And that's thanks to not only the discovery, but also the widespread adoption of the polio vaccine. Vaccines protect children and adults. As an example, the generation of pediatricians before me saw on a regular basis children who acquired bacterial meningitis and other serious bacterial diseases, leading not only to death, but to also huge health problems, hearing loss, developmental disabilities. I was fortunate to train after vaccines against bacteria such as Haemophilus influenza type B and pneumococcus had been developed. And as a result, I saw substantially fewer of these cases of bacterial meningitis. Newer vaccines against bacteria such as meningococcus have lowered the risk of preventable serious bacterial diseases even more. At Boston Children's, we are concerned by the softening of vaccine recommendations. Through these decreased recommendations, HHS is signaling to parents that there is a reason to question vaccines, that the risks of vaccination might outweigh the benefits. I want to be very clear. These vaccines are safe and effective, and they protect children from serious bacterial disease as they grow and develop. As a pediatrician and a parent, I urge other parents and caregivers to talk to your children's healthcare providers and to continue to follow the guidelines that have been established by reputable physician organizations, such as the American Academy of Pediatrics, the American Academy of Family Physicians, the American Medical Association. Children are at risk of preventable diseases, and vaccines save lives. We at Boston Children's do not support the softening of vaccine recommendations. Thank you.
And next, we're going to hear from Diana Cortez, a parent of affected children. Welcome.
Thank you so much.
Thank you so much, Dr. Toomey and Senator Markey, for having me. My name is Diana Cortez. I'm a mom of 4. My youngest daughter, Layla, has spent a lot of time at Boston Children's Hospital because she was born with a rare liver condition called biliary atresia. She actually had to have a liver transplant when she was just a year old. Honestly, it was a very scary process for us as a family, but we had some amazing medical folks guiding us the whole way. They really helped me figure out how to care for Layla during all that uncertainty. One of the first things her transplant team told us was to keep our whole family up to date on immunizations. Because of the medications Layla takes to protect her new liver, she cannot get some of the standard vaccines, such as MMR. Layla cannot afford to get sick. That means she's immunocompromised, and we have to be extra careful because preventable diseases could be a big threat to her. As a mom, it's really worrying when I hear about outbreaks of diseases that could just be prevented with vaccines. Kids like Layla rely on the rest of the community to stay healthy. She goes to school, and I go to work, and we have to trust that other families are doing their part to keep everyone safe. In short, I just want to encourage everyone to trust the science and keep their kids vaccinated so that kids like Layla can live happy and healthy lives. Thank you so much.
And finally, we're going to hear from Ellen McGinnis, representing the Massachusetts Nurse Association. Welcome.
Hi, good morning. My name is Ellen McGinnis. I am a nurse, and I belong to the Massachusetts Nurses Association, and we represent 26,000 nurses and healthcare professionals across the Commonwealth. I'm grateful to be here today. I want to thank Senator Markey and Massachusetts elected leaders who continue to stand up for children, families, and public health. When public health is under assault, leadership rooted in science and compassion matters. The recent decision by the Trump administration and HHS Secretary RFK Jr. to weaken childhood vaccine schedule is dangerous and deeply irresponsible. For nearly 35 years, we've been vaccinating babies against hepatitis B at birth. This is one of our country's greatest health achievements. Childhood infections have dropped by 99%. 90,000 children are alive today because of their policy. Rolling back those recommendations does not increase safety or empower families. It increases risk and it compromises care. We're already seeing the consequences. In this flu season alone, at least 3 children, and now I need to correct myself because I learned late last evening a 4th child has died in Massachusetts of flu-related illness. Hospitals across the Commonwealth are under tremendous strain with full ICUs and overburdened emergency departments. Families are grieving losses that never, ever should have happened. Vaccines aren't about an individual choice. They're a collective responsibility. They protect newborns too young to be vaccinated, elders, cancer patients, and people with compromised immune systems, like our friend Layla. They protect entire communities. As nurses and healthcare professionals, we are committed to protecting our patients and the most vulnerable in our communities. Weakening vaccine standards undermines our ability to fulfill that responsibility. Hear me and hear me good. We will not stop raising our voices. We will stand up for our patients, our communities, for public health, and for a future where every child has an equal chance to grow up healthy and safe. Thank you.
Beautiful. Do you have any questions on this issue of vaccines and their centrality to the protection of the health of children and every family member in our state? Anyone have any questions? Yes, ma'am.
Your advice to parents in going to ignore what has been coming down from the federal government, is that the takeaway here from parents that are trying to get this information and figure out what's best for their children?
I will let Robbie Goldstein speak to that, but my message is ignore Robert F. Kennedy Jr. Listen to the public health officials of Massachusetts. Vaccinate your children. They're safe and they're effective. That's the message that people in Massachusetts should be receiving. Dr. Goldstein.
Yeah, I'll just make it clear. It's a different Robert that you should ignore. You should pay attention to this one. Our recommendation is not necessarily don't ignore, but please pay attention to what the Department of Public Health here in Massachusetts is putting out. We have evidence-based recommendations on our website. We're communicating with clinicians with those evidence-based recommendations. We're working closely with the American Academy of Pediatrics. I also say that we recommend that folks talk to their healthcare providers, that they trust the physicians, the nurses, the nurse practitioners, the physician's assistants, those that are engaging with children and families in the exam room so that they can make the best decision for their child and for their family.
Question from anyone? Yeah, one more, yes.
What is your concern when it comes to this schedule change in a classroom and in school? What would the ripple effect be on that?
I'll start that. I'm sure others might have thoughts on this. So here in Massachusetts, we have school-based entry requirements around vaccination. Those requirements are not changing. Because of Governor Healy's leadership over the past 6 months, we've made changes to Massachusetts law and have executed on those changes such that the recommendations or the requirements for school entry remain linked to recommendations from the Department of Public Health. And as I said, those recommendations are based on the American Academy of Pediatrics. They're backed by science and evidence. They've been made in consultation with professionals, and they are not the recommendations that are coming out of the federal government.
I would just add, and I think you've heard this referred to in a couple different ways. If people start to choose not to be vaccinated, then what ends up happening from that societal contract perspective is that it could then lead to situations for where what we call herd immunity, the amount of people for whom they've been vaccinated is not great enough to prevent the spread of disease. So we're concerned that we could be putting children at risk by not vaccinating them.
Yeah, and I had measles when I was a kid. Every kid got measles. There was no vaccine. And children by the thousands died across the United States because there was no vaccine. So the message is, get the vaccine. It's safe. It's effective. Physicians recommend it, and it's absolutely ignoring our own public health history and what happened to just preceding generations of Americans because of the lack of breakthroughs in vaccines like that, as Dr. Poston said, that began here at Boston Children's. Any other questions? Thank you all so much. Thanks for coming. Appreciate it. Thank you. Thank you. Thank you.